The U.S. healthcare system was built on a private market model that depends on fair competition and functioning markets to provide healthcare services. Yet, the vast majority of healthcare markets have become highly concentrated, including over 90% of hospital markets in this country. And consolidation of the healthcare market is the key driver of excess health spending in the United States. In 2022, the U.S. spent $4.5 trillion on healthcare, amounting to nearly a fifth of the economy. There is little evidence that consolidation improves the quality of patient care, which is often touted as a justification for integration. Moreover, consolidation impedes access, both by making healthcare unaffordable and by leading to the closure of critical healthcare services, particularly in rural and low-income communities. The economic impact of healthcare consolidation is extensive. It depresses wages, inhibits job creation, and stifles economic development. Healthcare is consuming a greater share of the resources of the country, and these are resources that cannot be invested in other pursuits. Beyond these harms, healthcare consolidation also makes the health system more fragile. Large consolidated healthcare conglomerates are becoming too big to fail. Our dependence on healthcare monopolies without competitors or redundancies makes the health system vulnerable. The lesson is that loss of competition and redundancy, the transmission of key data, funds, or supplies through a single or a small number of pipes makes the U.S. health system and the health of all Americans vulnerable when a critical pipeline fails. There are several policy options that Congress and the federal government could consider to protect fair competition and health system resilience. And these include 1, strengthening antitrust oversight of healthcare consolidation; 2, considering a Glass-Steagall for healthcare, which would prohibit insurers and PBMs from owning pharmacies or medical providers; 3, improving price and ownership transparency; 4, closing payment loopholes that encourage vertical consolidation; and 5, protecting and investing in independent practices, pharmacies, and critical health care suppliers to promote competition and resilience. In sum, it is critical for policymakers and the public to grasp the urgency and magnitude of the threat that healthcare consolidation poses, not just to healthcare affordability and access, but to the very existence and long-term stability of the healthcare system.